Let's Talk About Pain, a podcast from the Quebec Pain Research Network. In each episode, we discuss the latest advances in pain research with guests from across Quebec in the health and research communities. Enjoy your listening. All right. So thank you for tuning in to today's episode of Let's Talk About Pain, a podcast brought to you by the Quebec Pain Research Network. So my name is Alex, and I am a graduate student in clinical psychology at Concordia University in Montreal, Quebec. And I'm going to be your host of today's podcast. So today we have a really interesting three-part episode that's going to be focusing on pain during cancer survivorship. So in this first part of the episode, we're going to be talking to Dr. Nicole Alberts. So Dr. Alberts is an associate professor of psychology and a Canada Research Chair in Behavioural Health Interventions in the Department of Psychology at Concordia University. She's also a member of the Centre for Clinical Research in Health and the Perform Centre for Preventative Health Research at Concordia. So Dr. Alberts' expertise is on characterizing and treating chronic pain among childhood cancer survivors, as well as the use of digital health interventions to target pain and psychological outcomes among medical populations. So thank you for joining us today, Dr. Alberts. How you doing?
Thanks for having me. I'm good. How are you?
Doing not bad. It's a nice day. Can't complain.
Good.
So, Dr. Alberts, I have a bunch of questions here that I want to ask you. And so the first thing I just want to ask you, can you introduce yourself a little bit more?
Sure. So, as you said, I'm Nicole. I joined the Department of Psychology here at Concordia University in 2020. So, coming up almost exactly on 3 years here at Concordia. Like you mentioned, I'm an associate professor in psychology in the Department of Psychology, and I also hold a Canada Research Chair in Behavioural Health Intervention. So in my job, I mainly focus on research, but I also teach and supervise students. And in terms of supervision, I supervise kind of a whole range of students at different levels. So undergraduate psychology students, as well as clinical psychology graduate students as well. And then I also teach courses within our clinical psychology graduate program here at Concordia, as well as some undergraduate courses, a bit more focused on like health psychology and pediatric psych. And then just kind of more non-academic research things. I'm from Saskatchewan originally, so I actually grew up on a farm near a little place called Yorkton, Saskatchewan, which is about an hour and a half kind of northeast of Regina, Saskatchewan. So I love going back there more so in the summer than the winter to enjoy the nice prairie kind of landscapes, fields, sunsets, all those pretty things. So yeah, that's a little bit about me.
Very interesting. So it seems like you got a lot on the go then with all the teaching, clinical work, that could be a lot. So again, thanks for sharing that with us. Now, the next question I wanted to ask you sort of, can you tell us sort of a bit about your background in terms of schooling? So how did you start, sort of this process and into professorship? How did that look?
Yeah, good question. So like a lot of people's journeys into research, but like clinical psychology especially, it's a bit of a long one, sometimes a bit of a winding path too. So way back when I started in Saskatchewan, so I did my undergraduate degree in psychology at the University of Saskatchewan in Saskatoon. As an undergrad there, I was really fortunate to be introduced to kind of research in general by a researcher whose name was Dr. Jamie Campbell. And I ended up doing my honors thesis as an undergrad with him. And then from there, I did my PhD in clinical psych at the University of Regina in Regina, Saskatchewan. And I did that under the supervision of Dr. Heather Hadjisteropoulos, and then went on to do my pre-doctoral residency in the departments of psychiatry and behavioral sciences and rehab medicine at the University of Washington Medical School over in Seattle. And then after that, did a 1-year kind of combined clinical and research fellowship, again, through the University of Washington, more so in the Department of Rehab Psychology. And through those 2 years in Seattle, too, I was able to work on research under the supervision of Dr. Tanya Palermo, who does a lot of things in digital health and pediatric chronic pain. And then at the end of all that training in about 2016, I joined the Department of Psychology at St. Jude Children's Research Hospital in Memphis, Tennessee, which is a children's cancer research hospital. So as an assistant member there on what's called kind of the clinician scientist track, so doing a combination of research and clinical work. So I was also an attending psychologist there, working with kids on treatment, as well as survivors of childhood cancer. So yeah, that's the journey.
Very cool. So it seems like, there's been a lot of moves, a lot of back and forth, but now you're back in Canada from the US, so that must be pretty exciting. Definitely a change up, but very interesting stuff. So where did your interest in pain research come from? You have a lot of experience talking about sort of your work in rehabilitation at sort of the University of Washington. Did your interest in pain research come before that? Was it really there that you developed sort of that interest? Where did it come from?
Yeah, so I mean, I think like if we really go back for me, even as like a teenager into undergrad, I've always been interested in kind of, and it's not necessarily pain specific, but we could include chronic pain conditions in that. Always interested in kind of how people respond differently to kind of different illnesses or health conditions. That's always just kind of been pretty fascinating to me. So whether it's been, like a chronic health condition or a chronic pain condition or something like cancer, kind of that range of responses um, has really been interesting to me. I've also, I think, always been interested just in how complex pain is, which is sometimes can maybe deter people from studying it or treating it. It's complicated for sure, but I like that challenge of it too, that it's not always super straightforward. And then I think I was definitely really lucky to just train starting, at the University of Regina, some places that have a really like rich history in pain research and clinical work, where like no matter what kind of research you were doing or your interests were, we got really good, solid training in pain. So working, like I mentioned, with Dr. Heather Gisteropoulos, Thomas Gisteropoulos, and Gordon Asmunson, all based at U of R. We're really lucky to have that training. And then same thing with the University of Washington, really being at kind of like, I don't know, the heart of like multidisciplinary chronic pain work, where a lot of it really kicked off, and working with colleagues there, both clinically and in research with Tanya. I think that really just like further cultivated kind of my interest in pain research. And then kind of near the end of my training, I always kind of was doing work in cancer and some work in pain. But then when I really started to kind of look into childhood cancer, just kind of learning and realizing like, whoa, there's not a ton of stuff has been done in this area. And when we look at the reasons why we think chronic pain would be a potential problem, either on treatment and then into survivorship, it just kind of surprised me quite a bit, like how far we had to go and kind of better understanding that and developing better treatments and things like that. So I guess it was a combination of things over the years that kind of led me to this particular area, but that kind of cultivated my interest in pain research and clinical work kind of through my training and into now. But
For
yeah.
sure. So it seems like, again, it's been something that's been brewing for quite a while, and then it just sort of cultivated to where it is right now. Um,
Yeah, for sure. And even, I was going to say, even working in, like you mentioned, the rehab medicine background, in that context, it's pretty cool. We get to work with patients kind of across like acute rehab or outpatient, people who are adjusting to a lot of different types of injuries and illnesses. But pain is often a common theme, right? In all these different contexts. So, yeah, even in that kind of rehab psychology arena, pain is a kind of a big topic that comes up no matter kind of what health population or, who you're working with. So,
For
yeah.
sure. Yeah, no, that's super interesting. So, the next thing that I wanted to sort of ask you is that, how would you describe sort of your current research program? Sort of what are the main things that or questions that you're trying to answer that you're really interested in?
Right. Yeah. So I usually kind of try to frame it like the bigger overall kind of purpose. And it's a big one. We're attacking a lot here, but it's basically to try to like improve behavioral health, which includes pain, and more of these kind of psychological outcomes, so things like anxiety, mood, in people kind of across the lifespan, so in kids and adults. But then with that focus on individuals who have been diagnosed with childhood cancer. And then within that, kind of more specifically, we're trying to kind of one, better characterize or understand pain among kids who are on cancer treatment, but then also into survivorship as well. And within that work of trying to better understand it, trying to identify what we call kind of biopsychosocial risk factors. So things across like medical factors, psychological factors, sociodemographic factors, kind of what plays a role in the development of pain in childhood cancer. And then, for better understanding that, it can help us figure out how to best treat pain as well. And then, like you mentioned earlier, then another kind of area that I do is developing like digital health interventions, digital health approaches to kind of better understand certain key research questions, but then also developing things like wearable based interventions, app based, web based, to target things like pain and some of these kind of psychological outcomes that we mentioned.
For sure.
So,
For
yeah.
sure. No, very cool. And I think too, like one interesting thing that I really like is sort of that lifespan approach. I think that I feel like in psychology and even in medicine, that's sometimes something that gets a little bit neglected, that we put people in a vacuum in a certain age and don't sort of consider, what happened before, what's going on now, and what sort of their goals are for the future. So I think it's really interesting to sort of take that frame on everything.
Yeah, for sure. Anytime you can kind of look at it in a more holistic way, yeah, and being able to kind of better understand and treat problems that might happen in childhood is often going to improve things for adults as they get older too, right? So it's all, yeah, very connected for sure.
Definitely. Definitely. Can you give us sort of an example of a current project that you're working on right now?
Yeah, so in collaboration with Dr. Jen Stinson at the Hospital for Sick Children in Toronto, I'm working on a project that's looking at what's called neuropathic pain among adolescent survivors of childhood cancer. So we were lucky to receive a pilot grant from the Guerin Family Cancer Center to support this work. And just briefly, neuropathic pain, it really kind of can come from a few different areas, but essentially kind of injury or damage or disease to what's called the somatosensory system. And people will often describe this pain as maybe like a burning or a shooting or kind of pins and needles type of pain that they have. And sometimes they might even have some reduced sensation as well. And because of the type of cancer treatments kids receive, it's thought that they're at increased risk for developing this type of pain, both while they're on treatment and then as survivors. Despite this, we don't know a ton about neuropathic pain in survivors. A part of what kind of got this study going is uh, Jen and I would present on pain and childhood cancer. And I remember for myself just getting this question a lot from audiences. Okay, so you know this and this about pain, but what about neuropathic pain? Like it always kind of, not always, but it would come up a lot. So we're like, yeah, what about neuropathic pain? Like let's just try to take an initial stab at kind of getting some pilot data on this. So essentially, with that project, it is a pilot project, so we're trying to get sort of a preliminary estimate of like the prevalence of neuropathic pain, as well as kind of associated like pain interference, so how it's impacting kids' lives, specifically, like I said, in adolescent survivors. And then we also kind of just want to be able to better sort of describe the nature of neuropathic pain in this group, and then what it's related to. So is it certain like sociodemographic factors, like I mentioned before, certain treatments that kids have had, other maybe like psychological factors, sleep, anxiety, anything like that. So yeah, and as a part of that study, recruitment is done at sick kids in their clinic there. So it's a pretty straightforward kind of survey based study that the survivors complete, on an iPad in clinic, completing our set of kind of measures. So yeah, that's one main one happening.
And I know there's others, but just for the sake of time, we'll keep it at this one. But that's very interesting, and sort of again using technology to sort of facilitate research with iPads in clinics, stuff like that. Not using paper and pencil anymore. So that's pretty nice to do that. Super interesting. So in terms of stages, it seems like you're sort of recruiting participants. Is that sort of the current stage that you're at with this project? Can you give us some more details about, have you been able to look at any preliminary results, anything like that?
Yeah, exactly. So we're right kind of in the thick of recruitment right now, which is going well, and we're hoping, we'll see, but hoping to finish that up by the end of, I'd say, this year, maybe even before then. But yeah, we're excited to be able to wrap that up and take a look at what we're seeing with the data, and then hopefully be able to get that published and presented at some upcoming likely pain and cancer conferences. Yeah.
Looking forward to seeing that when it does come out. So that would be
Mhm.
great. So I'm going to switch gears a little bit, Dr. Alberts, and sort of I just want to ask you, right now you talked about, even in your intro, you're supervising a lot of students. So currently sort of in your lab and your research, how many students do you have on the go? How does that look like?
Right. Good question. So they're not, I guess, maybe technically a student, but more research staff. We have kind of a full time research coordinator who helps with a few different studies, as well as just kind of the general sort of operations of the lab. I have an undergraduate psych student who just finished up his honors thesis and is now working as like a summer student, kind of RA in our lab, as well as a whole team of kind of undergraduate volunteers. So about 4 or 5 volunteers who are psychology students, kind of getting their first introduction to research, what it's like to work in a research lab. So that's been really cool. And then in terms of grad students, well, we have you in the lab.
Yeah, if I didn't mention that, I am Dr. Albert's student, but
The first one.
yeah, the
So
first one.
yeah,
Yeah.
Alex. Yeah, Alex is the first grad student to grace the Alberts lab. So we have him. He's going to his PhD soon here. And then we have another one, Claire Galvin, who's in her second year of master's in the clinical psychology program as well. And then we have another graduate student who will be starting this fall, which we're really excited about. So yeah, that's kind of the team in a nutshell right now. And I don't supervise her, but I would say we have, Rachel is a really important part in her role as a patient partner, as well. So we consider her as a part of the lab too, whether she knew that or
For
not.
sure. And that's sort of like an Easter egg for sort of what's coming up in the podcast today. So yeah, very interesting stuff to come. All right. So getting back into things, just sort of wrapping up, a couple more high level questions for you. What are some of the things that you're most proud of in your career as a pain researcher?
Hmm. Yeah, that's a tough one.
I know it's really putting you on the spot, but we're going to do it anyways.
That's okay. I mean, mean, I think just in general, I'm proud of the work we're doing to bring like more attention to the issue of chronic pain in childhood cancer survivorship and in trying to better understand it, which, like I mentioned, hopefully then that leads to better treatments of it true as well. Um, and especially, kind of proud of that, proud of it. But like I mentioned, because it has been kind of understudied, sort of overlooked both within research and clinical work. And we're definitely just kind of at the beginning of this journey. And outside of our lab, there's a few different researchers, a lot of them based here in Canada, who are doing some really great work in this area. So we're, I think, taking some really good steps in improving our knowledge, but also kind of bringing more attention to this issue. Um, and I think within that, I always often talk about within that context. A couple of years ago, we kind of proposed sort of a theoretical model about how pain may work in childhood cancer survivorship, or not even work, but kind of the pathways from treatment that might lead to it in survivorship. So kind of, some thinking around like different developmental factors, undertreated pain, some health related factors, how those can all sort of feed into the development and kind of maintenance of chronic pain kind of across the cancer trajectory. So that was a model and kind of a paper I did with Dr. Jen Stinson and a colleague of mine, Michelle Gagnon at the University of Saskatchewan. So that kind of really launched some of our work in this area and our thinking in this area. Yeah, and then I would be missing a huge chunk if I didn't say that I wasn't proud of everything you guys do in the lab. But
Yeah. No,
seriously,
no.
yeah. So prior to coming to Concordia, I supervised students, but I didn't necessarily supervise students kind of through their whole PhD program, that type of thing. So that's been really cool to kind of be a part of, people improving, growing, seeing people develop as kind of researchers and clinicians. And I would definitely say that's one of the best parts of the job
For
too.
sure.
So
For sure. And we
yeah.
definitely appreciate it as well. We
Well,
definitely
thanks.
appreciate it. So,
Thanks.
last question in sort of this part of the episode. Nicole, what do you think? Again, this is going to lead into sort of our later discussions throughout today's podcast. What do you think are some of the biggest challenges that you deal with as sort of a pain researcher or in your field right now?
Mm-hmm. Yeah, that's a good question. I mean, I think this is, of course, not surprising to any pain researchers or kind of people in the medical field. But like I mentioned earlier, pain is super complex and it's a part of, like I said, why I kind of love studying it. But I do think kind of pain in the childhood cancer context can make it even more complicated, right? So when you have kind of these complex treatments, potential side effects from the treatments, late effects later on from the treatments, to be able to kind of decipher everything that's going on there can be tough. And I think we often get the question, and maybe Rachel can speak to this later, just her experiences with this on the patient side, but in the research end or even clinically, people ask, well, how do you know that pain is due to the cancer treatments, or, it's not due to, another late effect of treatment, like a chronic health condition, or maybe something completely unrelated, like a low back injury at work. So, and those are good questions, right? And we're only starting to try to decipher some of that. Um, yeah, and in some ways, of course, it can matter for treatment, but sometimes too, yeah, we end up using a lot of the same treatments to sometimes tackle those problems. So I guess it's that balance, right, of like trying to characterize it a bit better, but then also almost keeping our eye on the prize, which is trying to make impactful changes for patients as well. And okay, so how is this improved understanding going to translate into like actually making better treatments and moving things forward in a clinical setting, right? So yeah, I think that just on a higher level can, I don't know if it's challenging, but it's definitely, something that we kind of have to manage. So yeah, I think that's something, and I think moving forward too, like most pain research, to be able to tackle these questions, we're really going to need that multidisciplinary approach, right? And we're going to need to tackle it from a variety of angles, and with colleagues and researchers in a few different disciplines, whether that be oncology, more of the survivorship, psychology, pain medicine, basic science, all that type of thing. So yeah, it's gonna require that team approach to really move things
Mm-hmm.
forward.
Okay,
Yeah.
great. Really interesting. So that's sort of it for our first part of the podcast today. We're going to take a quick pause and then we'll see you in a little bit. Thank you for listening to Let's Talk About Pain. Don't hesitate to subscribe so you don't miss an episode, and to share the podcast with your friends. For more information, visit our website at qprn.ca or our YouTube channel by searching Quebec Pain Research Network. See you next time.